This video is going to be a demo of an activity within VRpatients. So activities are available in both the clinical and out-of-hospital platform. And activities are single objective scenarios focused around a specific skill. So you can see some examples here: heart sounds, IV access, lung sounds practice. There's also some evaluations tied to these, so you can get some additional testing. It's a great way to get a lot of repetition in on a specific skill. So we'll go ahead and quickly demo the lung sounds practice. Some pre-briefing information. So just telling us we're going to be hearing different lung sounds. There's going to be some narration with these, and then we can practice them as we'd like. So we'll go ahead and hit start.
Welcome to the lung sounds practice activity. This scenario will allow you to change the patient's lung sounds and auscultate them using the stethoscope. To start, use the stethoscope and diagnostic tools to listen to normal lung sounds, or change the sound by using the lung sounds menu under Assess. To hear this again, click Repeat Instructions in the dialog menu under Narrator.
So as you saw there, I just pulled out a stethoscope. I can come up and listen to her sounds. We just have normal lung sounds to start. You can go posterior as well, so we'll go ahead and show you that real quick. And once I'm comfortable with normal lung sounds, I can go to the lung sounds library under this button. All the lung sounds available within the platform. So we want to get comfortable and learn about wheezes.
Wheeze. Wheezes are high-pitched musical sounds heard during expiration and sometimes inspiration. They result from narrowed airways, commonly seen in asthma, bronchitis, or COPD.
Pull out the stethoscope again. And we'll go ahead and do one more for you here. Oops. So let's go ahead. We'll do let's do crackles coarse.
Crackles. Coarse. Coarse crackles are low-pitched, wet, bubbling sounds that occur when air passes through fluid or secretions in the larger airways. They are often heard during inspiration and can indicate conditions such as pulmonary edema or pneumonia.
And there you can kind of hear it at the end. So that is a quick example of an activity. It's a great tool to be able to get a lot of repetition in on a specific skill for your learners.